too many lives have already been lost, and the BC NDP recognized that and formed the Ministry of Mental Health and Addictions. And we understand that this is a multifaceted issue, and there isn't one single magic bullet that will take care of everything. One of the things that we've done, in addition to the ministry, is we've doubled the number of beds for youth treatment, as well as provided adult treatment spaces, including First Nations treatment centres. Now, the BC Liberals waited until 2016 to announce this health crisis, and they also cut the number of youth treatment beds, which was not good for this issue whatsoever. John Horgan's government is working hard and collaboratively to make sure that we take a multifaceted approach and really address the intersectional issues that impact this crisis.
When I was Parliamentary Secretary for Corrections, I toured every prison in BC, and I talked to inmates and officials alike, and I found that addictions to drugs and alcohol really drive crime in BC. They drive homelessness, they drive poverty, and they drive the horrendous opioid deaths that we've seen. So we, in our platform, have decided to come to change course and to put harm reduction in its place as like an emergency room in a hospital where you help a person to survive, and then you move that person on to the hospital to cure the disease. And that's long-term residential treatment to free people from addiction to drugs and alcohol. We think that that would have a huge impact right here in Chilliwack, because about half of homeless people are addicted to drugs or alcohol, and particularly women on the street working in the sex trade are addicted, and we need to help them right here with long-term residential treatment leading to freedom from drugs and alcohol.
I've been advocating for a comprehensive response to mental health and addictions here in Chilliwack-Kent my whole public career. We need additional outreach workers. We need an assertive case management team here in Chilliwack-Kent. We need better access to mental health beds, more mental health professionals in the region. And as your independent MLA, that's exactly where I would start. Sadly, we've lost too many vulnerable folks here to the opioid epidemic, and successive governments have failed to address realistically what the issue is here, despite us advocating for years and years and years for a solution.